Thank you. You know, I've had the opportunity to talk to many of my fellow panel members, and this is a very distinguished crew you've put together. It's an extraordinary group of people, as anybody, all of us who've been to hundreds of meetings will say. It's really one of the better meetings, and maybe one of the very best meetings that we've been to. And that's a tribute to your very hard work. And I think it's also a tribute to we who have seen so much in our careers, that we know how valuable you are. You in the audience, you, the young people that make all of our work possible. We've reached a stage of our career where we very rarely do much ourselves. We rely on you to do the work. It isn't that we don't do anything, but we have used our wisdom to use your energy and your brilliance to our good effect. So it's a real pleasure to be here today. I'd like to talk about a couple of things that I think I've picked up that are gaps in the GapSummit. All right, so you have covered a lot, but the world is very big and you haven't covered it all. One of the first things I noticed in the introduction where we were having cocktails is almost a third of the people that I interacted with were from bioengineering. Raise your hands, bioengineers. Take a look around, just look around. How many bioengineers there are? A lot. How many of you are in the field of synthetic biology? Take a look. How much have we talked about bioengineering or synthetic biology? That's a gap. And it's a very interesting gap because what I see is the thrust of modern biomedicine, or let's say biology writ large, where we understand a lot about genes, we have massive technology, we have information technologies. What does it allow us to do? Certainly, one of the primary uses is for human health. But humans have many needs besides our health. We need shelter. We need food, as we've heard from the panel. We need many things, but in particular, let me point out that we're very worried that all of our needs are going to poison our environment. And the major poison, not the only poison, but the major poison is CO2. We're taking hundreds of millions of years of sequestered carbon and pumping it back into our atmosphere. And whether this peculiar weather today is, we attribute it to it, certainly the long-range trends are. What is the promise of industrial biotechnology? It's to totally replace fossil carbon with atmospheric carbon. And that is real today. Let me just give you one of the major uses. If you think about all the fossil fuels that we pump and dig out of the ground, it's mostly used for energy. It's mostly used for our cars, our planes, our heat, etc. Can we realistically replace that massive use of carbon with atmospheric carbon? And the answer today is yes. It's a matter of price. Right now, it's probably about 60 to 70 cents a liter for fuel to drive our cars, to heat our homes, to drive our factories. The cost of biofuel, taking carbon dioxide from the air, is now about $1 per liter. That 40 cents is poisoning us. Can we, through one means or another, get that price down to 60 cents? I think we can. I think that's a major challenge for all of us. It's realistic and something you bioengineers can help us work out. How do we reduce the cost of the biomass? How do we convert that biomass efficiently to jet fuel, biofuel, kerosene, whatever we need to do? It's a question of bioengineering, agriculture, and molecular biology and bioengineering, and it's something that can be done, and it's something that about half of the, when I saw all the hands go up, it's about a half of the audience can work on, and I would encourage you to do that. Not only that, but it's not just the energy that we can make. We can replace almost all of our carbon sources, the clothes we wear, the materials that we build from, the very fine chemicals that are our pharmaceuticals, we can replace with bioengineered substances. I have the great fortune, and I've had the great fortune to work with one of the leaders in synthetic biology, Jay Kiesling, who many of you, I know you know because I've spoken to you about him. I worked with him originally about 10 years ago to make the drug artemisinin through the Gates Foundation. I was involved in helping him get that money. I was involved in helping create the Joint Bioenergy Institute, which has got $500 million from BP, and then from the NSF, another $500 million to do the work that they've done, pioneering a number of different technologies. And I'm currently involved with him in creating a new biofoundry to take the wealth of genomic information we have, allow us to recombine that to make almost any organic molecule we want, polymer or otherwise, quite quickly, efficiently, to replace, as I say, to replace fossil carbon with atmospheric carbon. So that's one area of great promise, and I encourage the GapSummit to focus on that amongst the other really interesting areas you focused on. You can't cover all the gaps, but I think that's an important one to touch on. There's another issue, which I touched on in the panel, which is an opportunity that all of you in information sciences and health, I urge you to consider. And that's how we can use our understanding of systems, information, health, to make sure that everybody in this world has access to high quality, affordable health. It's not only about drugs. Most of healthcare is, in fact, not drugs. In fact, it's not even medicine. There's a whole area called social determinants of health. You've heard people talk about health as a subject of wealth, and that poverty is itself a disease. But in fact, when you look at what's happening globally, and I have the opportunity through Access International to work in the Philippines, to work throughout China, throughout India, Singapore, Northern Europe, the United States, I see some major trends in healthcare itself, which I think are important to discuss with you. And that is, over the last, say, especially since the war, the World War II, we've been focused on hospital-centric care. And where it works, it's marvelous. In Singapore, you get terrific results. I wrote a book called Affordable Excellence, of how with 4% of your GDP, with hospital-centric care, you can have the best health outcomes in the world. But that is rapidly coming to an end as a consequence of demographic change. Demographic change is going to define your life, because the pyramid, rather than going like this, or even like that, is going like that. You're getting an inverted demographic period. You are going to be supporting your parents, your grandparents, maybe even your great-grandparents, and your children, and their grandchildren, and your grandchildren. That's a lot for you, this generation, to support, especially when it comes to healthcare needs, because the healthcare of people who are now living into their 80s, 90s, 100s, and in your generation they'll be living over 100, are multiple chronic diseases that are very poorly treated in a hospital-centric system. There is a way to deal with that. It's distributed healthcare. What do we mean by distributed healthcare? A healthcare system, which is not just a healthcare system, it's a health and wellness system. It's one which relies on wellness and modification of disease process to keep people healthier. And you don't do it in a hospital. You do it at home, you do it in communities. In poorer countries, you do it in villages and in clinics. You distribute healthcare. And we are very fortunate to live in a time when technology allows that to happen. In the most modern hospitals today, over 60% of surgeries are done on an outpatient basis, in the morning, out at night. That's for total hip replacements, open brain surgery, in the morning, out at night. You can do enormous types of surgeries and medicine outside the hospital. Much better for the patient. You distribute from a center, outpatient clinics, secondary hospitals, clinics, home, and you unite that through an information system. Information is critical if you're going to have quality. You need to have distributed healthcare systems in which the quality is assured by a central information system which tracks in real time. I've seen now hospital information systems which are better than anything you'll see in any industry. And I've checked this with some of the top consultants. Ask yourself, what industry has a totally comprehensive garbage collection to surgery equivalent in real time, which is interface free, so no equipment is incompatible with any other piece of equipment, which is transparent vertically, and very important, transparent horizontally, so everybody can see in real time how they're doing as compared to their neighbor. Those systems exist, and when they exist, allow the transition from a hospital-centric system to one which is distributed to outpatient, to clinics, to home, where you capture all of that information in real time. Think of the business opportunities in that massive transformation. In the US alone, that's a $3 trillion industry, which is in the process of being transformed. How does that compare to what I see around the world? When I look at China, I see a disaster being made this very day. They are building 5,000 and 10,000 bed hospitals. They are building medical cities where to get treated, you have to leave your city and go to the neighboring city. How stupid is that? Do you want to be in a hospital with 10,000 sick people? What do you think the chances of getting some horrible disease? It's very high. The more people who gather in a hospital, the sicker those patients are likely to get. So, and it's unaffordable. You cannot afford to treat large numbers of people. And in countries like India that are trying to solve their healthcare problems, they've built a number of really good hospitals, and they've given what's called universal healthcare coverage, which is free hospital coverage, but no coverage, essentially, until about a month ago, for people who live in villages or in smaller cities or who can't get to hospitals. The model that I'm talking about is actually a model for universal healthcare coverage to supply universal healthcare at a cost we can afford, which then allows us to develop the high-cost drugs that keep us alive and keep your grandmother alive from 90 to 110, right? And that is where we are today. So let me just thank again the organizers, thank you, the participants, for this wonderful experience we've all shared. Thank you very much.